Stephanie Bell Flint joins us now to talk about acid reflux. And if you have questions, you can send them to the doctors at WLBT.com.
All I can say is you probably need to stock your cabinet now. Being Thanksgiving.
Yes.
Joining us today is Dr. Anthony Petro with Baptist Health Systems to tell us how to avoid a little indigestion and whatnot at Thanksgiving. Is there any particular food that just doesn't sit well with people at Thanksgiving that's a traditional food?
Well, the problem with reflux is there's a sphincter below your esophagus that goes into your stomach. When it's not functioning properly, whenever your stomach is full and it doesn't empty properly, that acid will go back up into your esophagus, which has no protection from the acid. So yes, don't eat too heavy, not fatty foods, and no wine with your foods or alcohol, and try to eat 3 to 4 hours before you go to bed.
Now, the thing I've noticed is that food that never used to bother me before, things with tomato-based, tomatoey, very acidy foods, now they do tend to bother me. And the first time I had acid reflux, I didn't know what it was.
Well, as long as that happens infrequently, you're okay. You can take over-the-counter medications. When it happens 2 or 3 times a week, when you have persistent burning, or when you wake up at night with acid in your throat and you're coughing and have aspirated, then you need to do beyond over-the-counter medications. You need to see your doctor.
Well, what are some over-the-counter medications that you can take if it is, I guess you'd say, infrequent heartburn?
Immediately when you're burning, you take an alkali, Malox, just one of the multitude of oral agents. Now, for long term, to prevent the acid from being in your stomach, there's histamine inhibitors and proton pump inhibitors. Prilosec is now over the counter, but in lesser doses than you would prescribe if you have significant reflux. And there's a multitude of new proton pump inhibitors that you take prophylactically. You take them every morning. Once someone has sustained reflux, you don't take the proton pump inhibitors when you reflux, because the half-life is about 8 hours. And the thing that people misinterpret most about reflux is once you have significant reflux, you will never be well. Something is wrong with that sphincter. And one of the means to take care of it is persistent proton pump inhibitors every day.
Well, because I understand that if you do continue to have acid reflux, it could actually cause some problems with the esophagus. Is that true?
Well, you will digest your esophagus much like you'll digest a steak. You have no protection from acid in your esophagus. You initially will get esophagitis. If it's persistent, a rare person will develop a type of healing epithelium, a Barrett's metaplasia, which infrequently, but does happen, can develop into a malignancy.
Right.
If you reflux enough, you can harm your vocal cords. You can be hoarse and have a persistent sore throat. If you aspirate enough, you'll have a chronic cough. But all of these are from reflux.
What makes that sphincter break down or lose its elasticity?
Well, it's a physiologic sphincter, and when you swallow, it relaxes to let the food go in your stomach. When it's in your stomach, it's supposed to contract. We don't know why it happens. There are things we do. That is never fixed for people who have persistent reflux. And there are means to make this sphincter refunction. When you have a hiatal hernia, which a lot of people do that have reflux, you've got that sphincter up in your chest, and there's negative pressure when you breathe in. So you want positive pressure in that sphincter, so when you have negative pressure in the sphincter, you reflux more. Even when it's not working, there are many people that don't even have a hiatal hernia, but when it's not working, it'll reflux from the abdomen too. And when you have persistent reflux or when you have persistent esophagitis, then there comes a time to when you want to do something to augment that sphincter. People who are grossly overweight or significantly overweight can die. There's generally a weight where they don't want reflux. Outside of that, in doing the things that I told you about earlier, then you're looking at a laparoscopic approach that does 2 things. One, it delivers the sphincter below the diaphragm where there's positive pressure in your abdomen. And the other thing we do is wrap the distal esophagus with the upper part of your stomach after we mobilize it. Then when you eat a meal, you have the positive pressure in your belly, and when your stomach contracts, it puts that pressure on that sphincter and makes it competent.
So you're saying that being overweight can cause?
Absolutely. Yes,
Really?
it can cause reflux.
Now, what causes it at night? That's the time that it's worse. You're asleep and you're awakened. You feel that burning going up your esophagus. You feel like you're strangling. You can't breathe. What causes that?
It's mechanical. You've eaten a meal, your stomach hasn't emptied, you lay flat in bed, and the path of least resistance is up your esophagus.
That makes
You don't-
sense.
Wow. Amazing.
And people who have reflux, if they don't consider the surgery, they need to elevate the head of their bed at night, put 4-inch blocks beneath the head post.
Goodness
Wow.
gracious.
All right, Dr. Anthony
Amazing.
Petro with Baptist Health Systems. Thank you so much. We'll get ready for Thanksgiving as best we can.
I mean, really?
Thank
If you'd
you.
like more health news, you can go to our website, WLBT.com, and just click down there on Medical Matters.